work sessions. A, Food Assistance Programs Update, Ms. Rogers and Ms. Hill.
Good afternoon, everyone.
Good afternoon and welcome.
Chair, Vice Chair, members of the board, thank you for this opportunity to share a little update with you all about the various food assistance programs that the Department of Social Services oversees and administers for Chesterfield County's residents. In addition to an overview of the services we provide, we're also going to highlight or spotlight the Chesterfield Food Bank, who has been a tremendous partner with us in helping us to meet unmet needs that some of the safety net programs that we administer do not cover. You have thank you, Kim. Kim and I forged a really strong partnership and collaboration during the pandemic. She worked with us tirelessly. I believe every week, several times a week, we were meeting to make sure that we were responding to the food needs in the county. And so from that forged a great relationship where I now am also on their board, and we work together as partners in addressing the food insecurity within the county. I just wanted to do a quick overview of just the food insecurity. So food insecurity, you all probably already know this, but we serve people who may have very little to no food insecurity, as well as those folks who don't have enough to eat, and people who don't know where their next meal is coming from. And those are going to be the most insecure folks as it relates to food. One of the things that we look for in individuals who would be at the bottom of the continuum are folks who are altering and adapting their food choices because they aren't able to meet the needs. So if people are buying less expensive food that may be low quality and not as good for your health, those are some of the factors that we look at when we're looking at individuals who are food insecure. Some of the resources I'll talk about is the Supplemental Nutrition Program. Then I'll highlight a few things that Chesterfield County Public Schools offers as it relates to meeting the needs of kids who are experiencing food insecurity, and then the vital role that our community partners play in helping us to address this issue. I'll begin with the SNAP program, the Supplemental Nutrition Assistance Program. That is our second largest program that we administer. We process a little less than 1,300 applications a month. As of May 31st, we had over 17,000 SNAP cases that my department oversees, which equates to almost 35,000 recipients. So that would include children, seniors, and adults in there. In FY23, we administered over $91 million of SNAP benefits that were injected into the community so that people could have buying power to purchase food. One thing about the SNAP program, it is not intended to meet someone's complete food needs. It is to be a safety net to help close the gap of food insecurity, but not to meet the full need. When I talk a little bit about the partnership with the food bank, that's where our collaboration comes in, where once the government programs that we administer aren't able to meet everyone's need, everyone doesn't qualify for supplemental nutrition assistance, everyone receives a varying degree of financial support through the program, and so wherever that gap is, that's where our community partners help us to meet that gap. We administer or distribute EBT cards. That's the card that's used for individuals to purchase things in the store. Monthly, we are distributing about over 400 cards are distributed, and those are new issuance as well as reissuance. You may have heard in the media about fraud that had become after the pandemic with the EBT cards, and so people were spamming the cards or some kind of computer glitch where people were tapping into the benefits and transferring onto their cards. So we have had to end cards and redistribute, so that we have seen an increase in the number of cards because we're stopping the cards that have been compromised or corrupted and ensuring that individuals are able to get their benefits. In FY for this year, as of May 31st, we had issued almost 5,000 EBT cards this year. One thing that we're really excited about is a collaboration with the Community Engagement and Resources team. I talked to you a little bit about one of the elements of food insecurity is when people have to compromise quality of food because it tends to be more expensive. And so we've partnered to allow SNAP benefits. So individuals who are receiving SNAP have purchasing power at the Chesterfield Food Farmers Market. And so we're really excited about that collaboration because it does allow families to get the fresh produce and things like that at a reduced price. One of the huge partners is the Chesterfield schools. The schools participate in similar program that funds the SNAP program through the USDA for their free and reduced price lunch program. One piece of the free and reduced lunch program is that the county does participate in the community eligibility designation, and that's where they look at the population of students in that school who are receiving the means-tested programs that we administer, such as the Temporary Assistance for Needy Families program, and then the SNAP program. So after a school passes that threshold, everyone in that school becomes eligible for free and reduced price lunch. Last year, Chesterfield had about 40 schools that were participating in that program. During the pandemic, you heard the word PEBT card, and so that was a effort at a state level between the Department of Education and the schools, Department of Education and the Virginia Department of Social Services, where kids who were at home and not able to get the free and reduced lunch during the day, the families were given a PEBT card so that they could have an opportunity to get food while kids were at home a lot longer. There have been a lot of changes in that program, but that was one that while we did not determine eligibility and we didn't process those, we were still responsible for being a partner with distributing the EBT cards. And the school has a variety of other food and nutrition programs like the after-school snack program, as well as supper, as well as 6 schools participate in a fresh fruit and vegetable program. I was about to say veggies. Kim will talk a little bit more about that, which is a good segue to just the partnership with the Chesterfield Food Bank. Our mission starts with in collaboration with individuals, families, and the community. And this is just one of our partners. We also partner with CHASM and Catholic Charities, just different places who also help us to meet the food needs. You'll hear from, without further ado, to do their presentation, hear from the food bank about their partnership, and they help to support the community partners that we go to as well. So I'll turn it over to Kim.
Could we have not had a more awesome board? What did I do?
I got you.
Okay. Could we have not had a more awesome board member in Kiva Rogers?
Thank you.
Kiva, thank you.
Thank you.
Thank you. To the Board of Supervisors, we just want to thank you for letting us be here today. We want to thank you for the continued support through the years. You know, the annual support with the community grant and, of course, the CARES Act money that that help us build up our refrigeration and our fleet of refrigerated trucks. Chesterfield Restaurant Week was amazing. It turned out to be a great, great event for Chesterfield, and we're so glad that you guys chose us to be a part of that event. And then, of course, the grant that you guys just approved a few months ago to allow us to increase our senior program and to make sure that our seniors are getting the quality of food and personal care items that they need. And we're excited to what that program's going to look like in the future because of your investment. In front of you, you have our books of our 2023 annual report. We will be touching on a few of these items with the presentation. But as of right now, I'd like to introduce Nick Jenkins, our Director of Outreach. I know you guys know Nick, and Nick's awesome. And, of course, our rock star Kelly Kays, our Director of Development. They will be walking you through the presentation. So Nick, I'm gonna let you take it.
Thank you so much. Yeah. Thank you again for having us today. We are excited because Chesterfield is growing, and you guys have initiated amazing programs such as the Experience Chesterfield, and of course, the Chesterfield Restaurant Week, which is highlighting why this is such a phenomenal community to live in, and we're so grateful just to be a part of this community. We also recognize that as we see this growth, this population growth, that we're going to be experiencing growth in people who need assistance or people who fall through those cracks or in that gap, as Ms. Rogers referenced. And we're excited because that's why we're here. We're here to make sure that our neighbors don't have to go without food, don't have to go without a meal, and we can together, through collaboration and partnership, overcome food insecurity right here in Chesterfield County. One of the areas that the food bank holds very close to us are at-risk populations, and two of those are our seniors and our children. For our children, we recognize indeed that 56% of our kids rely on that free or reduced lunch here in Chesterfield County. So one of the ways that we have taken this realization on our shoulders is through our Kids Summer Food Program, where we're able to reach 8,000 to 10,000 of those children annually, providing five lunches, 5 snacks, and 5 breakfasts that are kid-friendly, so that during those summer months when they're not able to rely on those meals provided by the school system, they're still not having to worry about where their next meal is going to come from, and it provides parents with a little bit more peace of mind knowing that their kids have accessible food and nutritious food at home. One of the initiatives that we're getting ready to launch in the 24-25 calendar year for schools is our school pantry program, which will initiate through a pilot program of 4 selected schools out of the many that requested our assistance, where we're going to be able to put in and maintain pantries within these schools that will provide basic accessible food and some basic toiletry or basic necessity items outside of food items themselves, and make sure that it's accessible to the kids and is in line with what they need to be able to make sure that our kids can go to school focusing on school and not having to worry about food. What does food insecurity look like in our county? It is indeed that individual that's gone more than one day without food, but more often than not, it's that person who's working 40 hours a week or more and still just does not have enough to make healthy food choices, or to ensure that there's consistent food within their house at the end of the day. So we are positioned to catch those individuals, those teachers, those EMTs, those public service workers that are critical, food and retail workers that are critical for our community. But unfortunately, due to the compounding variables that we're facing as a community, are not able to keep food on their plates. We want to make sure that we are there to catch them and help ensure that they have systematic steps forward to sustainability. 46%, I do want to add, 46% of our audience come from these individuals that qualify as food insecure, but unfortunately do not qualify. They exceed the threshold for SNAP-based benefits. So it is us really trying to target that people group that is unfortunately getting a little bit underserved in this time of need. And then some of the other variables that really influence our food insecurity that we're facing here in Chesterfield County, but across the nation, outside of the cost of living just going up, the cost of groceries have consistently gone up as well. We saw 11% in 22 and another 5% in 23. Buying groceries for families, I have 4 kids at home. It's outrageous. Our food bill has gone up significantly. And what we've recognized is that if we're able to provide about 7 days worth of food for a family of 4, we not only provide them peace of mind knowing that they're going to have food tomorrow or the next day, but we also alleviate a little bit of strain on the limited resources of their finances, where they can take that money and reallocate it towards bills that are pressing, or maybe even having a little bit of a moment to sigh and breathe and collect themselves to find out what the step forward they need to take to create sustainability in their lives. And that's really the mission of the food bank, is fighting hunger and empowering lives. And we want to see our clients not only have their basic need of food be met, but we want to address the underlying causes of that food insecurity.
Okay. Since COVID, we have seen a pretty steady increase of need come to us. Currently, we're serving around 5,000 households on a monthly basis. That equates to about 20,000 visits from individuals in the Chesterfield County area. Let's see, here we go. Okay. The next slide is that we're looking at a map of Chesterfield County. This is a density map showing the folks that we serve, the darker color indicating where most of them live, and the lighter, of course, is a little bit less so. We are on pace to serve 2.5 million pounds of food into our community. That is fresh meat, fresh produce, dry goods, dairy products, all of that. 90% of the individuals we serve live in Chesterfield County. We are Chesterfield County's food bank. The trucks indicate our Food on the Move program, which is our food distributions where folks are lined up in cars to receive a grocery cart full of food. That's what those are indicating up there. We do this 9 times a month in the county. That includes our special senior distribution that we do once a month at our Chester location. We know that we can't do this alone, and collaboration is key. We could not do this without the partners that work with us. We have many churches and other nonprofits. We all work together to make sure that the folks in Chesterfield County that need food have their needs met. The icon that you're seeing up there now indicates where those pantry partners are located. Some of these partners are maybe a church that comes and gets food and creates a hot meal for the folks that they serve. Others may have a small pantry, while other nonprofits may be serving our homeless community and those who are unhoused by giving them emergency bags that we put together for those particular situations that they live in. And finally, we have our school pantry program. Nick touched on this a little bit. We're already feeding thousands of children in Chesterfield County who desperately need food. When Dr. Daughtry invited us to present a project that we're hoping to do the school pantry, we met with all the principals at their meeting, and the feedback that we received from them is that some of them do have pantries already. Other nonprofits are helping them with that, but they have a hard time consistently keeping them stocked, and that's something we can help with. And this is a gap that we can fill. So we're really excited to be launching that program. We'll start with 4. We didn't know this at the time, but you'll see on the slide that all the schools that raised their hand and said, we desperately need this help, are in our service area. So it really kind of indicates where that food insecurity truly is residing in Chesterfield County. We are more than a food bank. Our mission is fighting hunger and empowering lives. We've always focused on fighting hunger, and the last couple of years, we have been expanding our focus to empower the lives of those we serve. Last year, we empowered over 1,900 individuals with services beyond just food. You can see some of those services highlighted here. I'd like to point out the homebound services. A lot of people don't know this, but we deliver groceries to folks that are homebound. We work with, we do some of that delivering ourselves. We also work with the Shepherd Center, who helps us reach people who are homebound or lack the transportation to get to the food that they need. We also work closely with James House, finding shelter, find that housing. We sometimes are the first step for these folks. Another thing, number up here I just want to point out is a number we're really proud of is the 28 individuals that we have helped find substance abuse help through rehab and also mental health services. We work with Robin's Hope, you may be familiar with them, and many other nonprofits, and I think some county services for mental health. And then rehab facilities, we work with The Fix, in Genesis, I believe, New Genesis, to help folks. And we just want to make sure that people are not only getting the food that they need, but they're also getting the help that they need to rise out of the situation that they're in. This is amazing. All this amazing work happens through our outreach programs and through our new client advocate program that we have. We even have a new resource center. Some of you have been out to the food bank to see, and those of you who haven't, I'd love for you to come and see it. It's a warm and welcoming environment where many of these connections take place. We're hoping, with help in the future, we'll be able to expand this program quite a bit. we know that we could do more.
We're looking forward to a bright future. And the future that will hold the resources that we need to serve our community in such a greater degree in years to come. Thank you for having us today.
Thank you. We thank you for being here. Supervisors, comments? Supervisor Miller.
Mr. Chair, you all know what's near and dear to my heart, which is Brightpoint, and I just am so excited of that partnership with Brightpoint and that that's moving forward. It is heartbreaking to be sitting with a student, and they're doing everything they can to be successful at Brightpoint and not be able, and be in the middle of food insecurity. And so now we've set up, we know where the food pantry is going to be. It's going to be in the T building, and it's going to be there and stored and refrigerated and all those kind of things. It is terrific, and I'm just over the moon excited for what y'all are doing with us at Brightpoint.
Supervisor Engel.
Want to thank you for all the work you're doing. I know you're working with a lot of groups already. I recently saw Backpacks for the Homeless, which is doing a great job, reaching out for some help to be able to continue to serve the food side of it. They've got the other, they give a lot of socks and a lot of other things that are needed, and I saw that they may have to give up the food side of it if they can't get some more food donations. So if you can reach out to them, I know they actually met a woman in the woods living in a tent that was bipolar and off her meds. Through the food and the other stuff they gave them, they were able to establish a relationship with her, help her to get on her meds, and today she drives for Uber or Lyft, and nobody else helped them except for that organization. So if there's something you can do to help them, I think that would be good.
Yeah, absolutely. Ernie's a friend of mine. He's a great guy, and that's a great organization. We have worked with them in the past, and we actually have a meeting, I think, tomorrow. So we do our best not to waste time. There you got some endorsement. Amen.
Absolutely. Supervisor Snyder.
Thank you. I was just there and visited, and I'm very excited. And again, I'd love to come and help sometime. And Kiva, speaking to the SNAP, again, as when I was a single mom, I mean, that was the only option you have sometimes to just get it through. And so thank you so much for the, I posted the thing about the free lunches at the farmer's market, and it was one of my most shared post on my Facebook. So it's definitely something that's important to people. And so I just think that it's great, and I love it. So thank you so much.
Supervisor Carroll.
Thank you, Mr. Chair. I actually haven't been to the food bank. I've actually volunteered there on a Friday evening. You still do other locations within the county? If you could speak to that a little bit for the community?
Well, we do. I think you are Matoka,
Yep,
am I
mhm,
correct?
yep.
And you know we have an Ettrick distribution right there at Virginia State.
Yep.
And, but yes.
I'm aware, but the people in the community might not be.
This is
So
true.
this is a great
This
opportunity
true.
for you to tell them.
That's right, that's right. We have what we call Food on the Move, and that's mobile distributions throughout the county. And we do have to thank the school board and the school system for allowing us to use the schools for those distributions. And every month, we are at the same locations because it's not always convenient for clients to come to Chester just for a distribution. So we are at Beulah. We're at A.M. Davis, which we're getting ready to move from Reams because the construction at A.M. Davis is sort of moving us out there. So we're going back to Reams. We have chocolate distribution on Turner Road. We have our Ettrick distribution down in Ettrick. And then, like I said, our 2 distributions in Chester, 2 at Journey on Monday evenings, and then our motel ministry and our senior programs. So yes, that's what all those locations were on the map. And we will make sure it is on our website, and we are constantly on social media posting it. So we will make sure you guys get the information you need, and anybody that has any other questions, please don't hesitate to reach out.
Thank you. Thank you, Mr. Chair.
Continued success to you all. Dr. Casey.
Usually I don't comment, but I just want to again thank you for the hospitality, and any and all board members. I know many of you have already taken a tour, but seeing is believing. And I will say on behalf of the county employees, we offer volunteer hours. It's a benefit the board has granted to all employees to donate a certain amount of time per year to a nonprofit organization. And I think it goes without saying, our employees, one, they love working and volunteering so much for you that many come back on their own time to volunteer further. So that's just the continuing of a partnership, and a partnership that was greatly expanded on behalf of the board, and a contribution when you had to serve so many people in so many different ways, that all those capital improvements have come to fruition thus far.
All right. Thank you, Dr. Casey. All the best to you and your endeavors.